Heart disease is the greatest health threat to Americans and remains the leading cause of death worldwide. February is American Heart Month. Dr. Eric Penniman of Summit Medical Group is sharing more about heart disease and ways to maintain a healthy heart.
American Heart Month is so important because it's the #1 cause of death. And when you talk about heart, you talk about the blood vessels, and diseases of the blood vessel leads to all sorts of other problems, including not only with your feet, but with the brain, and ultimately can cause stroke. And so everything that we do to try to prevent cardiovascular disease, it has so much relevancy in so many of the disease processes that happen to all of us later in life. And so you just can't ignore this. And honestly, in primary care, I would say the majority of our office visits are really focused on trying to reduce somebody's risk for developing cardiovascular disease. Some risk factors you can't do much about. You're born with it. You know, for instance, your age. Obviously, all of us are going to get older. The older we get, the higher the risk. Family history definitely plays a role. But then there's the modifiable risk factors, such as high cholesterol, history of smoking, physical inactivity, high blood pressure. Those are the real major risk factors that you can do a lot about. And that's where in primary care, we help people manage their blood pressure. We help them control their cholesterol. We try to get them onto a good aerobic exercise program. We can really help the majority of patients avoid having bad outcomes, such as a sudden heart attack. 85% of all sudden heart attacks can be prevented. So it's really important to get a primary care doctor, whether it's a family doctor or an internist, and have them help you manage your blood pressure, your cholesterol, your activity levels, your diabetes, all of those things that'll make just a huge difference in helping to avoid cardiovascular disease.